Which of the following tasks is outside the scope of a home health aide's duties? A. Assisting with bathing and grooming. B. Administering oral medications. C. Checking vital signs. D. Providing companionship. Answer, B. Administering medications is typically outside the HHA's scope unless delegated by a licensed professional and allowed by state regulations. When assisting a client who uses a walker, the aide should A. Hold the walker while the client walks. B. Walk behind the client. C. Ensure the walker is the correct height and stable. D. Push the client in the walker. Answer, C. The walker must be correctly fitted and stable to prevent falls. Aides ensure safety but do not manipulate it while the client moves. Which observation should the aide report immediately? A. A client refuses dinner. B. A client has a dry mouth. C. A client has slurred speech and facial drooping. D. A client is sleeping longer than usual. Answer, C. Slurred speech and facial drooping are signs of a possible stroke and must be reported immediately for emergency care. What is the most important reason to use gloves during perineal care? A. To protect the client's modesty. B. To keep the client comfortable. C. To prevent the spread of infection. D. To avoid contact with soap. Answer, C. Gloves protect both the aide and the client from pathogens during exposure to bodily fluids. If a client becomes confused and tries to leave the house, the aide should A. Physically restrain the client. B. Block the door and calmly redirect the client. C. Let the client leave. D. Call the family immediately. Answer, B. Gentle redirection and ensuring safety are key. Physical restraint may be harmful and inappropriate. When documenting care, the aide should A. Record only what was unusual. B. Include personal opinions. C. Use exact observations and actions taken. D. Wait until the end of the week to write it. Answer, C. Documentation must be factual, timely, and accurate to ensure legal and quality care standards. Which is the best method to check a client's temperature if they are unconscious? A. Oral. B. Tympanic, ear. C. Axillary, underarm. D. Rectal. Answer, D. Rectal temperature is preferred in unconscious patients due to reliability and accuracy. An aide notices the client has reddened skin on the heels. What should the aide do? A. Massage the area. B. Apply lotion. C. Report it and avoid pressure on the area. D. Ignore it unless it worsens. Answer, C. Early signs of pressure ulcers must be reported and pressure relieved immediately to prevent further damage. A client tells the aide she feels useless and wants to die. What is the best response? A. Ignore the comment. B. Tell her not to say things like that. C. Reassure her and report the statement. D. Change the subject. Answer, C. Statements about death or hopelessness are serious and must be addressed with empathy and reported. What should an aide do before feeding a client with dysphagia? A. Give the client water. B. Check the client's swallowing plan. C. Tilt the client's head backward. D. Ask if the client wants solid food. Answer, B. Swallowing safety plans are vital to prevent aspiration and ensure proper feeding procedures. What is the first step a home health aide should take before assisting a client with bathing? A. Gather clean towels. B. Test the water temperature. C. Ensure privacy. D. Explain the procedure to the client. Answer, D. It is essential to explain the procedure to the client first to ensure consent, reduce anxiety, and build trust before proceeding with personal care tasks. When transferring a client from bed to wheelchair, what is the correct body mechanics technique for the aide? A. Keep knees straight and bend at the waist. B. Lift with arms and twist body. C. Bend at the knees and lift with legs. D. Keep back arched during lifting. Answer: C. Using your leg muscles and bending at the knees helps prevent back injury and provides a safer lift for both the aide and the client. What is the best way to communicate with a client who is hearing impaired? A. Speak loudly and slowly. B. Shout directly into the ear. C. Use written notes or sign language if needed. D. Use hand gestures only. Answer: C. Written communication or sign language ensures clarity and dignity when working with clients who have hearing impairments. A client suddenly becomes unresponsive. What is the HHA's immediate response? A. Call the client's family. B. Try to wake the client for 5 minutes. C. Call emergency services, 911. D. Wait to see if the client wakes up. Answer: C. Emergency services must be contacted immediately if a client becomes unresponsive, as this could be a life-threatening situation. Which food is most appropriate for a client on a soft diet? A. Granola. B. Raw carrots. C. Applesauce. D. Toasted bread. Answer: C. Applesauce is easy to chew and swallow, making it suitable for clients on a soft diet due to dental or swallowing difficulties. When documenting care, what should an HHA do if they make an error? A. Erase and rewrite it. B. Use whiteout. C. Draw a single line through the mistake and initial it. D. Tear out the page. Answer: C. Proper documentation includes crossing out errors with a single line and adding initials to maintain legal and medical accuracy. Why is hand washing before and after client contact critical? A. It's a hospital policy. B. It reduces odor. C. It prevents the spread of infection. D. It improves circulation. Answer: C. Hand hygiene is the most effective way to prevent transmission of infections between clients, caregivers, and the environment. How should soiled linens be handled? A. Shake them to remove debris. B. Place them on the floor. C. Roll them away from the body and place in designated bag. D. Place directly on furniture. Answer: C. Rolling soiled linens away from the body minimizes contamination and placing them in the designated bag follows infection control standards. Which action best promotes a client's independence during mealtime? A. Feeding them quickly. B. Encouraging them to feed themselves when possible. C. Cutting off their food entirely. D. Avoiding interaction. Answer: B. Encouraging self-feeding supports dignity, independence, and helps maintain fine motor skills. What should be reported immediately to a supervisor? A. A small appetite. B. A skipped bath. C. A fall, even with no injury. D. A misplaced sock. Answer: C. Any fall must be documented and reported right away, regardless of visible injury, to monitor for potential delayed complications. What is the primary goal of hospice care? A. Curing illness. B. Rehabilitating the client. C. Comfort and quality of life in end stages. D. Prolonging life at all costs. Answer: C. Hospice focuses on comfort, dignity, and symptom management for clients in the final phase of a terminal illness. When should an HHA chart client care? A. Once a week. B. At the end of the shift. C. Immediately after providing care. D. Before care is given. Answer: C. Documenting care right after it's provided ensures accurate, real-time records and prevents forgetting important details. If a client complains of chest pain, what should the HHA do first? A. Offer water. B. Call the family. C. Call 911 immediately. D. Massage the area. Answer: C. Chest pain may signal a heart attack. Emergency services must be contacted immediately for prompt medical attention. Which is a sign of elder abuse the HHA should report? A. Wrinkles. B. Forgetfulness. C. Unexplained bruises. D. Gray hair. Answer: C. Unexplained bruises may indicate physical abuse, and it's the HHA's legal duty to report any signs of suspected abuse. How often should an immobile client be repositioned to prevent pressure sores? A. Every 2 hours. B. Every 8 hours. C. Once daily. D. Only when asked. Answer: A. Regular repositioning every 2 hours helps maintain circulation and prevents the development of pressure ulcers.